Hi Lena, thank you for submitting your concept map for week 6. You have made many great links amongst the diagnoses, the medications, the lab work, and potential problems the patient may experience. This concept map demonstrates that you have a strong knowledge base that you are applying towards the patient. It shows you were critically thinking when making the connections and looking at how everything was related. The links you have made between the diagnoses, medications, and laboratory results has created a strong base for you to build upon, which is evident through the potential problems you came up with that the patient may experience while being in the hospital. These potential problems allows you to anticipate what to look for if changes occur with your patient, preparing you with the knowledge to deal with the problems. Some things that I want you to think about are any links that can occur between alcohol withdrawal and melena. Could these be related to one another? What about hallucinations or delusions? Could those be linked to alcohol withdrawal? I'm going to be sending you a resource that you can take a look at to see and consider if these are related. You have highlighted many areas that you could teach the patient about, such as diaphragmatic breathing and pursed lip breathing, which is excellent for the patient who has a diagnosis of COPD. I want you to think about the patient when you are going to be teaching them about diaphragmatic breathing. We must think about the patient and the medical terminology we use. Our ultimate goal is to teach the patient these exercises they can use at home to help with breathing, as you've pointed out. This could potentially decrease the chance of them returning to the hospital should they experience trouble breathing again. When teaching them, use layman terms instead of terms like alveolar ventilation. We want to keep it simple for the patient to understand. Instead, you could say, help the lungs expand. You have highlighted areas as barriers to discharge for the patient. Our goal is to help patients heal so they can return home. So identifying these barriers can help us work towards the goal of discharge. You identified the 3 barriers keeping him in hospital: low oxygen, limited mobility, and kidney injury. These are areas you can work on with him, with other disciplinary staff, to get him back to baseline and hopefully go home soon. Great job in realizing what these areas were that were keeping him in hospital. In the future, you could add how you were going to help the patient with the barriers. For example, for his limited mobility and him being unable to perform his activities of daily living, you could also have added how you're going to help the patient with these areas, such as promoting his independence and encouraging him to dress himself or wash himself. Since you're looking after the patient for 3 days, each day you could build up to him being more independent, because he was independent before coming to hospital and we want him to be independent again. Lena, you have done a great job with the concept map. It is evident you are looking at the patient holistically and considering how all his diagnoses, medications, and labs are linked, and considering what complications could occur for the patient, which shows you have a strong knowledge base with the connections you have made. Creating all the potential problems shows you are prepared should any of these complications occur. You are considering potential problems, which allows you to be prepared should the problems occur. It is evident you are thinking about patient safety, which is our #1 goal. Fantastic job.